Let's get to the meat of it. We're bringing back our panel with a topic weighing heavy on the minds of most of you right now, the coronavirus. It's not news that the spread of the virus is spiking and posing its own mortality risk, especially in our Black and brown communities. Now it appears that street outreach workers are not only dealing with violence prevention, but they're also trying to educate the community about the outbreak. So how is this affecting your mission? Dr. Slutkin, let's start with you. How is coronavirus affecting the mission? I mean, are we getting to the meat of the problem or are we being delayed now?
Coronavirus is complicating things seriously. Everything, actually, the economy and where people can go and not go. And it's definitely responsible directly and indirectly for the increases in violence that are seen not only in Chicago, but otherwise around the country. So the increases in violence that are accompanying COVID are showing up in most cities in the U.S. There's about a dozen cities that have increases even larger than Chicago. Chris and Adrian can describe the reasons for it because they're closer to it in Chicago. I just want to add, this is very common for epidemics, that epidemics cause other epidemics and they begin to get conflated. And just to add that outreach is essential for both of these problems, as you mentioned.
Chris, have you had to pivot? What are you doing to try to combat both at the same time?
Yeah, so here in Chicago, like Dr. Slutkin mentioned, and across the country, outreach staff are responding to shootings and homicides as we've been doing historically. But in addition to that, now we've taken on the task of spreading public health information and knowledge around COVID and how to keep safe. So we've seen outreach workers across the city of Chicago, across the nation, handing out food baskets and boxes to families. We've done more than 3,000 a week at the Institute for Nonviolence. We're passing out PPEs and pub ed information to keep people informed. One of the other components in which we're doing is also trying to discourage large group gatherings. So oftentimes in the communities we work in, people are congregating at the parties and on the blocks, kind of hanging out. We're trying to educate as best we can to prevent people from either going to jail or contracting COVID.
And how do you combat two things at one time? I mean, UCAN, I know, is out there trying to help, but do you feel as though you're being thwarted?
I think we are really doing the best that we can, to be quite honest with you, right? So as Chris talked about, like, we're doing two jobs at one time, and one is not one that we're really used to. So violence interrupters are not healthcare providers, but they've stepped into the role like champions, in my opinion, to go out and talk to people in community. And it seems a little bit easier for them because they're already trusted. So it's not like somebody from the outside is coming in to tell them about something. It's people who they already have relationships with, and they're showing up at, as Christopher said, at large gatherings and, you know, on blocks and, you know, in the vacant lots where people are still kind of, you know, hanging out and doing everything that they were doing before COVID. So it is difficult, but I think we're handling it.
Dr. Slutkin, do you find that, and it was mentioned, Chris mentioned that violence is escalating, but we're not hearing as much about it because maybe the pandemic is getting, you know, more publicity, for lack of a better word of using it, more attention?
Well, I'm not sure what attention is being given to it in Chicago, but these two problems and the support that these communities need are really central to the life of and the future of the city. And so, and the approaches that are being used in terms of outreach and interruption and the infrastructure that there is the essential solution. I want to add that there probably isn't enough of it.
Yeah. You know what?
Yeah.
I'm going to pause you guys for a minute because we're going to come back and talk a little bit more about this. I want to thank you for your input thus far, but still to come, another local organization on a mission to make change.